The spine is composed of a series of bones and discs that are designed to stack one on top of the other and support both the weight of your body as well as protect the spinal cord and the nerves as they leave at each region to go innervate the different structures of your body. So it basically consists of a bone called a vertebrae, and then another bone called a vertebrae, and then a disc in between, which is filled with a jelly-like substance and an outer sort of shell. And the disc sort of acts to cushion the bones as you walk on them. And anytime you develop a hole in the outer shell that allows the jelly inside to squirt out, or the disc dries out a little and bulges and starts to contact nerve roots, that's what causes the symptoms of the ruptured or herniated disc. So the disc rupture can affect the surrounding nerve in one of two ways. One is through, and the easiest way to understand is by shear pressure. The nerves are contained inside of bones and ligaments that protect them, so there's a limited volume that they're able to accommodate. When you have a disc rupture that gets into that area, it can push the nerves up against either bone or tough ligament and put pressure on the nerve. The other common way is that the jelly-like substance on the inside of the disc is very inflammatory, so it causes a big immune reaction when it gets released out into the open. So just experiments that have taken the jelly-like substance and dripped it onto the nerve roots have found that it creates this huge inflammatory response. The most common symptoms of ruptured disc, people will come in and say that they were doing something and then all of a sudden felt a pop. So they were swinging a golf ball, they were helping move boxes, and they felt a little bit of a pop, and then they start to have a lot of, if it's in their low back, which tends to be the most common thing from lifting, it tends to be the low back pain and the buttock and leg pain that travel down the side, or they say their sciatic nerve is starting to act up. Those tend to be the most common symptoms. If it's in the neck and they were doing something, they'll say they felt something in their neck, and then now they have searing sort of arm pain that comes down the side, or pain in their shoulder blade area. The way to diagnose a ruptured disc is the best way is a history and physical. So coming into the doctor's office, take your history and a physical. And if those are suspicious for a ruptured disc or your symptoms are consistent with a ruptured disc, then the best way is by MRI, which will show the size, the shape, the location of the ruptured disc, and also tell you how big it is and how small it is and what you can do about it. Treatments for the ruptured disc can range depending on the size, the location, and the severity of the discomfort that the person is in and whether they have any weakness or neurological symptoms. The easiest treatments are you come in and you find out sort of what it is, and we do conservative treatments, so anti-inflammatory medications, observation, and then and some physical therapy for core strengthening. If that doesn't work, we could then progress up to epidural steroid injections, which function to put some cortisone and some steroid around the nerve root itself and try to calm things down and calm that inflammatory reaction that jelly-like substance causes on the nerve root. And then if that doesn't work, then talk about surgery. The type of surgery depends a little bit on the location and the size of the herniation. If it happens in your low back, the most common surgery is called a microdiscectomy, where we make a small incision on your back and go in there and just pluck the fragment of the disc that's herniated out and relieve the compression and the inflammatory response on that nerve root. The recovery from that tends to be actually pretty quick. It's a same-day surgery. Most people feel better immediately. They can go back to activities like physical therapy within a couple weeks, and then usually at the 6-week mark, they're sort of free to resume doing all their normal activities.